After 48 hours, the time required to ensure essential services are in place, we will move to level 4. These decisions will place the most significant restrictions on New Zealanders' movements in modern history.
In the beginning of the lockdown, there were no other testing labs in the country that could offer the COVID-19 test, so GCG needed to work very closely with LabPlus to provide them the capacity they needed for testing. We had to band together as a university and as a unit to pull in enough equipment and enough staffing to enable us to process upwards of 1,500 swabs per day. It was scary. You're working with an unknown virus, so these were people working in an incredibly stressful situation with a virus that not many people understood. This is a clinical world where these are university researchers used to the research world, so for them it must have been a very scary time. We had to first pull in the staff who were able to do the testings. We also needed to pull in the equipment for the test, and then we needed to train all of our staff and ramp up from there.
There are a couple of challenges actually around modelling in COVID. One was, of course, that COVID was a very new disease, and actually at the outset we knew very little about the disease. And so that was a big challenge in terms of how you might tune the model to fit that particular disease. The other challenge with modelling in COVID is actually we wanted to model things that weren't going to happen. So a politician is sitting there going, well, should we have a lockdown? Should we go into lockdown this week, or should we go into lockdown the following week? Which of those choices might be the best choice? And so there you've really got to use a model.
Even with vaccination, such a large proportion of our population can't get vaccinated because they're too young.
We want to reclaim the right to tell our health story and our health future.
This is one additional opportunity to encourage those congregations to come forward and get tested.
Look, people might be frightened about what I'm saying, and I want them to be frightened because this is a really scary time. We've got a major pandemic on our hands, 11 million deaths worldwide. We've got 28, we've been spared it, but if we don't get everyone vaccinated rapidly, we're going to have a lot of deaths on our hands. This is my professorial message, vaccination, and this is my non-professorial message.
The Global Vaccine Data Network is a consortium of around 18 countries across the world who all have the capability to use big data to look at and answer questions about vaccines. My co-director and I hosted a meeting in France, and we went there with the proposal that this would be coordinated in New Zealand. These are the largest vaccine safety studies ever undertaken by a long shot. And the grant that we have is the most money ever invested in any vaccine safety studies.
The university is an incredibly powerful tool and very valuable for the Auckland region, and it really showed the strength of the university and the hospital banding together as a united front.
New Zealand researchers, my colleagues at the University of Auckland and all over the country, have really come together to get this pandemic under control.
It's fair to say that the international research community really see value in what we're doing here. The opportunities now that we have within this network for others to come in and to use this platform are unlimited, really.
Kia ora tātou. We have now been through almost 2 years of quite extraordinary times. Despite the personal and professional challenges, this has brought out the best in our research community, and I think the country has been extraordinarily well served in the way this expertise has been mobilised. The pandemic has thrown a spotlight on the skills and resourcefulness of our research and technical staff across a remarkable range of disciplines. It has also highlighted relationships with a wide span of external partners. Our researchers have been prominent in supporting communities, including ensuring the voices of the vulnerable have been heard. I would also highlight relationships with a wide range of government agencies with whom we have worked. I'd like to acknowledge the extraordinary efforts of our researchers and support staff and offer both my personal thanks and the thanks of the university for their work. We are certainly not through this yet, and we need to ensure the same energy and expertise can be harnessed to address the very large challenges ahead of us.